Do vaccines cause multiple sclerosis? We know it's possible for vaccines to induce inflammation and demyelination, injury to the myelin, the fatty sheath of the nerve fibers that's the target of injury in multiple sclerosis. This article describes the infamous 1976 swine flu vaccine, which was suspended December 16, 1976, after it was found to be associated with an increased risk of Guillain-Barré syndrome, an autoimmune disease of the peripheral myelin, different from MS but with some similarities and the possibility of causing paralysis, though the risk was fairly low with an excess risk compared to the unvaccinated population of only around 1 in 100,000, and subsequent flu vaccines linked to Guillain-Barré syndrome had an even lower risk, only about 1 in 500,000, but people were terrified. And people have been talking about the putative association between MS and vaccination long before this. This is a case series from 1967 showing reports of MS onset or exacerbation of existing MS shortly after different vaccines like smallpox, yellow fever, and typhoid fever. But what about modern vaccines that are actually given in 2025? And these are just anecdotes, not evidence. What is the denominator? How many people received these vaccines and did not develop MS, and how does the rate compare to the risk in the general population? After all, some people will coincidentally develop MS or have an MS flare shortly after vaccination, even if it's not the cause. In order to answer that question, we have to look at proper observational studies, and that's exactly what I'm going to do in this video, citations below. My name is Brandon Beaber. I make videos about MS every Wednesday. I report no specific financial conflict of interest. There are few technicalities I'll explain at the end of the video and give my own personal opinion, but first I'll just show you the data. We'll start with the human papillomavirus or HPV vaccine. This is given to prevent cervical cancer and certain strains of genital warts. This is an observational study of a cohort of roughly 4 million girls and women in Denmark and Sweden, and they looked at the risk of multiple sclerosis diagnosis within 2 years after receiving the HPV vaccine. Now keep in mind for this and all of the studies that it's theoretically possible that an insult to the body could increase the risk of something like MS many years later. We know, for instance, that Epstein-Barr virus is linked to MS. That's the cause of mono, but the average age of diagnosis of MS is around age 30, but over 50% of people are infected with EBV by age 6, so we're only looking 2 years ahead. It doesn't necessarily look at any possible association just in the short run. Keep that in mind. They looked at the crude incidence of MS in the unvaccinated population on the left, and it was 21.54 per 100,000 person years, which was much greater than the vaccinated population, only 6.12 per 100,000 person years. But unvaccinated people tend to be a little bit different in other ways. They tend to be younger on average, and so adjusting for factors like age and other potential confounders, the relative risk with vaccination was 0.9. So they're roughly the same risk, and obviously there was no statistically significant difference. The confidence interval is 0.7 to 1.15, so 10% lower risk, but not a statistically significant difference. But they found no association between the HPV vaccine and risk of MS within 2 years. Here's a meta-analysis on the HPV vaccine. Obviously, I can't show every study on every vaccine. I'm just looking at a few representative studies, and they looked at different demyelinating diseases, mostly multiple sclerosis, but also other things like isolated optic neuritis or inflammation of the optic nerve, and they found the odds ratio for CNS demyelinating diseases overall was 0.96 with the HPV vaccine. In other words, 4% lower risk on average, but the confidence interval is wide. No statistically significant difference. They analyzed it for only multiple sclerosis and only optic neuritis, and there was no association. The HPV vaccine does not seem to be clearly associated with MS risk. What about COVID-19 vaccines? This is data from France, a huge study, a cohort of over 100,000 people with MS. This is a national database, and they looked at the risk of MS MS exacerbations in people with existing MS, flares, things like optic neuritis or transverse myelitis, inflammation of the optic nerve and spine in people who already have MS in different doses of vaccines. So the first, second, and third doses of vaccines on the three charts A, B, and C. And you can see that 0 is when the vaccine was administered, and the frequency of relapses, it does not seem to increase after vaccination. In fact, there's a slight decrease at the time of vaccination, presumably due to some kind of reverse causation. In other words, people who are having a relapse or not feeling well are kind of less likely to go get a vaccination at that time. They looked at different types of vaccinations, mRNA vaccines, viral vector vaccines like deactivated adenovirus. It made no difference. None of these vaccines seem to be associated with an increased risk of MS relapses afterwards. Here's a nice study on something called radiologically isolated syndrome. These are people who have MRI findings that are consistent with MS, but they don't have any symptoms. For instance, maybe they had an MRI for a different reason, like migraines or head trauma, and they were incidentally discovered to have lesions typical of demyelinating disease, but had no reported symptoms or exam findings. Now, the diagnostic criteria have very recently changed such that some of these individuals would now be considered to actually have multiple sclerosis, but I won't get into that technicality. This multicentric observational study in different countries, France, the US, and Turkey, looked at what is the risk of developing clinical MS, in other words, actually having attacks or symptoms or MRI progression in these individuals who are at higher risk of MS. And prior studies suggest a lot of people with radiologically isolated syndrome may have around a 50% risk of multiple sclerosis, depending on other factors like presence of spinal cord lesions or findings in the cerebrospinal fluid. But they looked at the risk of developing MS with or without COVID-19 vaccines, and the risk in the vaccinated group was 6.7%, and the risk in the unvaccinated group was 8.5%, no statistically significant difference. So COVID-19 vaccination did not seem to increase the risk of getting MS if you had radiologically isolated syndrome. The same was true for COVID-19 infection. There was no statistical difference in risk of getting MS. It was 12.1% risk in people who had COVID-19 infection versus 13.5% of those who did not have COVID-19 infection. And there are many other studies that show this same finding. Next, let's shift to the yellow fever vaccine. Yellow fever can be life-threatening, though it's only endemic to certain areas, for instance, in Africa and South America, and usually vaccination is only recommended to people traveling to at-risk areas. It's known that a rare side effect of the yellow fever vaccine is inflammatory neurological disease, which is quite frightening, and people have been concerned that this could somehow cause or exacerbate MS. Indeed, the vaccine can induce the production of pro-inflammatory cytokines, inflammatory cell signaling proteins. In this study, people with MS who received the yellow fever vaccines, their interleukin-producing cells skyrocketed compared to unvaccinated people with MS or people with MS getting the flu vaccine or healthy controls, though the same thing happens in people without MS getting the yellow fever vaccine, and yellow fever-associated neurological disease or yellow fever vaccine-associated neurological disease is somewhat rare. In this famous study published in JAMA, the risk of MS relapses in people with the disease skyrocketed after the yellow fever vaccine. They reported within 3 months after vaccination, the annualized relapse rate, or relapses per person per year, was about 13 in people getting the vaccine versus less than 1 during other periods, such as prior to vaccination or more than 3 months after vaccination. In modern clinical trials, often the placebo group only has an annualized relapse rate of about 0.4, so 13 is terrifying. However, this result has not been recapitulated. This is a larger French observational study with 128 participants. 32 received the yellow fever vaccine versus people who did not receive the vaccine. And you're looking at a survival curve. The proportion who are free of relapses, it starts off at 100%, and then over time more and more have relapses. And the unvaccinated group is in black and the vaccinated group is in red. They did have a little bit more relapses, but the hazard ratio was 1.33, so 33% more relapses, but it was not statistically significant. The confidence interval 0.53 to 3.3, so clearly there isn't a dramatically increased risk, though there's a slight non-statistically significant trend. It seems unclear that the yellow fever vaccine is dangerous to people with MS. Next is hepatitis B. There's long been a concern that the hepatitis B vaccine could increase the risk of MS. This is data from the United Kingdom General Practice Research Database 1993 to 2000, a case control methodology. They look at people with MS and people without MS and look at vaccination rates. And 6.7% of people with MS had been vaccinated against hepatitis B versus only 2.4% of controls. And when correcting for multivariates, they found an odds ratio of 3.1. So threefold increased risk of MS in people who had the hepatitis B vaccine. The numbers don't work out here, but they're correcting for other factors. There are some criticisms of this study. On average, there was quite a long delay from symptom onset to diagnosis, about 5 years on average. If they did a different analysis where they just looked at diagnosis of MS within 3 years of hepatitis B vaccination, there was actually no association, but it's hard to ignore this odds ratio. And apparently a long time ago in France, 3 people who developed MS after hepatitis B vaccine were compensated after a ruling by the court of law. However, various other studies have shown no association whatsoever between hepatitis B vaccination and MS risk. For instance, this is data from the famous Nurses' Health Study 1 and 2, a total population of about 238,000, and they looked at it in different ways, but if you just look at the bottom line, vaccinated at any time prior to potential diagnosis, you can see the odds ratio is 0.9, actually slightly lower risk, obviously not statistically significant, in people who are vaccinated, definitely not a higher risk. This study looks at pediatric MS. It's a case control design looking at 143 people with MS versus 1,122 matched controls, people with similar characteristics as the cases of multiple sclerosis. And if you look at the proportion who were vaccinated against hepatitis B at any time, it was 55.9% of people with MS versus 54.3% of controls, roughly the same, no clear link. Here's a meta-analysis on 13 different studies looking at hepatitis B and risk of MS, and there was a slightly increased risk in people getting the vaccine, odds ratio of 1.19, 19% higher risk, but not a statistically significant difference. You can see the confidence interval interacts with 1. It's really not clear that there is any association. Now we'll look at a few studies that look at multiple vaccines at once and the risk of MS. This is a case control study from the CDC, 1995 to 1999. You're looking at the proportion who are vaccinated with and without MS. So we're seeing, are there a disproportionate number of people with MS who have been vaccinated in the past? And we're looking at different vaccines. It's a little bit difficult to look at data in this way, but you can see the percentages who are vaccinated is roughly the same. You could also look at the odds ratio. So an odds ratio of 1 in people with MS would suggest equal risk between vaccinated and unvaccinated individuals. So they looked at hepatitis B, again an odds ratio of 0.8, 20% lower risk in people who are vaccinated. For tetanus, it seemed there was a slightly reduced risk, 40% lower risk, odds ratio of 0.6, confidence interval of 0.4 to 0.8. Maybe that's a fluke. But for other vaccines, influenza, measles, mumps, rubella, the odds ratio is roughly 1, equal risk vaccinated and unvaccinated. They did the same thing with optic neuritis, and again, there were no clear effects. Here's a meta-analysis looking at the risk of MS after vaccination, and I highlighted the odds ratios in red. So the BCG vaccine for tuberculosis, not given in the United States because it interferes with the assay to screen for tuberculosis. Hepatitis hepatitis B, influenza, measles, mumps, rubella, polio, typhoid fever, they were all not associated with MS risk at all. You can see the odds ratios are very close to 1. Interestingly, for diphtheria and tetanus, the odds ratios were 0.6 and 0.68 respectively, and the confidence intervals do not interact with 1, suggesting a slight but statistically significant reduction in MS risk in people who received these vaccines. I'm not sure I actually believe this is a real phenomenon, but that's what they reported. They also looked at the risk of relapses after the flu vaccine, and there was a slight trend towards more relapses, relative risk of 1.24, 24% increased risk, but not a statistically significant difference. So overall, really no clear sign that any of these vaccines increase the risk of getting MS. Similar studies have looked at the risk of relapse after vaccination in people with existing MS. This study looks at 643 people with MS who had relapses and looks at where they had the relapse relative to vaccination. Now, they're presuming an at-risk period of 2 months. In other words, saying if you're going to get a vaccine-induced relapse, it's going to be within 2 months. That's kind of similar to what is seen with diseases such as transverse myelitis or Guillain-Barré syndrome after a vaccine, so they chose a similar time period. Of course, in reality, it's theoretically possible, as I mentioned before, that an insult could cause some kind of problem much later. We don't know that for certain, but they chose 2 months. But if you look at the relative risk of MS relapse after receiving any vaccine or specific vaccines like tetanus, hepatitis B, flu, or combining vaccines, it made no difference. There was no increased risk of MS flares after vaccination. Here's the same analysis from the French data that I showed earlier, that huge observational study with over 100,000 people with MS. They looked at the risk of MS relapses, again, in people who already have MS within 60 days of having these vaccines: diphtheria, tetanus, pertussis, pneumococcus, the pneumonia vaccine, and the flu, and none were linked to MS relapses. You can see the odds ratio was exactly 1. In other words, exactly equal rate of relapses in that 2-month time period compared to a random 2-month time period not after vaccination. I found one small study on risk of MS relapse after specifically the H1N1 flu vaccine, only 60 participants from Italy, probably too small of a sample size to really draw a conclusion, and they only looked at the risk of relapse within 30 days of vaccination, but it did not seem to obviously increase risk. Obviously too small of a sample size to really know for certain. Now, I want to get into a few of the technicalities that I didn't mention earlier. The first is the idea of an MS pseudo-exacerbation. It's very well known that people with MS, if they have an insult to the body, especially a fever, that can temporarily bring out symptoms of MS. And it's not like it's causing new injury, demyelination to the nervous system. It's thought that as the body temperature is increased, there's a decreased ability to get information through previously injured neural tissue. For instance, someone could have optic neuritis, and 10 years later they could have a bad fever, and it feels like they're having optic neuritis again, when in reality they're having recrudescence of the old symptoms, such as blurry vision. The same thing with transverse myelitis. People could get numbness and weakness, and it seems like an MS relapse, but it's really the fever bringing out the old symptoms. Sometimes this is even the first presentation of multiple sclerosis. So I have a patient who was hospitalized for fever, and he also had a lot of difficulty walking, and he had MRI scans which were strongly consistent with multiple sclerosis, but the lesions looked old. None of them were active, though he denied any prior symptoms. It turned out he had endocarditis, infection of the heart valve, and had very high fevers, and so the fever was essentially bringing out his multiple sclerosis symptoms, making the symptoms obvious. He was treated with antibiotics, his fever went down, and he improved dramatically neurologically, though he still did have multiple sclerosis, though with minimal symptoms at that point. And so it can be quite difficult to know what is a true attack or true onset of MS versus this recrudescence phenomenon. And the ability of physicians to adjudicate this, even in clinical trials with highly qualified academics, is simply truly not perfect. And so you can get all these weird confounders. Someone could get a vaccine and have fever from the vaccine, and that could be misinterpreted as an MS relapse or cause someone to be diagnosed with MS earlier than they would have. Or you could get, say, the flu vaccine, and it could prevent you from getting the actual flu, which would have caused a multiple sclerosis pseudo-exacerbation. And so it can kind of look like the flu vaccine is preventing attacks when in reality it's not. So it could get a little bit confusing. Another thing is that the researchers in these studies are kind of thinking of MS like it's a form of Guillain-Barré syndrome, like it's Guillain-Barré syndrome of the brain and spine, but it's actually quite different. So with Guillain-Barré syndrome and the famous 1976 flu vaccine-related Guillain-Barré syndrome epidemic, the risk period was about 10 weeks. In other words, more than 10 weeks after vaccination, there was really no increased risk of Guillain-Barré syndrome. And if you think about Guillain-Barré syndrome, what's happening? You have a lymphocyte, like a B lymphocyte, that's seeing a piece of the vaccine, and it has some antigen that's kind of similar to the peripheral nervous system myelin, and then it produces antibodies that attacks that myelin because of this molecular mimicry phenomenon, and it takes several days for lymphocytes to develop and produce antibodies. So usually the attack occurs a few weeks later, and by 10 weeks, if your lymphocytes haven't had this adverse response, it would make no sense for them to suddenly start developing autoreactive antibodies. Suffice it to say, there's very strong evidence that MS is not like this. We know that the pathophysiologic onset of MS is years or even decades prior to symptom onset. I have a whole separate video on this. I'll link it in the description below. For instance, one piece of evidence for this is that some people with radiologically isolated syndrome, again, that's a phenomenon of having an MRI that's consistent with MS but no symptoms, don't actually develop symptoms until many years later. Also, very good analysis of healthcare data suggests there is an increase in prevalence of some symptoms such as numbness and tingling, or even mood symptoms or decreased energy levels in people who are subsequently diagnosed with MS many years later, suggesting that the injury to the brain was occurring before. So I think if you really want to know if a vaccine is associated with MS risk, you really have to look many, many years in the future. Unfortunately, the 2-year study on the HPV vaccine is not 100% perfect in adjudicating that it's safe. You really have to look at 10 or 15-year data, and of course, we will get this data over time. Another difference between MS and Guillain-Barré syndrome is the prevalence. So with modern flu vaccines, it's sometimes been reported that there is an excess risk of Guillain-Barré syndrome, but the excess risk is only about 1 in 500,000. MS is much, much more prevalent. The lifetime risk in the US is around 1 in 500. And so I think people get a little bit overexcited about a few case series with common diseases or relatively common diseases like MS. People will coincidentally get MS shortly after vaccinations, even if there's no causal association. Anecdotes really aren't evidence, and people should not overreact to them. So I'll end with my personal opinion. I'm not convinced that any vaccine clearly increases the risk of getting MS or causing MS relapses. I'm not convinced there's any association with the Hepatitis B vaccine. If there really was a 3-fold increased risk, it should be easily detectable in those other large observational studies. If something is associated with MS, it should be associated multiple times. Think about the risk of MS with smoking. The association is actually quite low, with a relative risk of less than 2, yet numerous studies all show this clear but weak association between smoking and increased risk of MS. We should be able to see it if it's there. The vaccine I'd probably be most concerned about is the yellow fever vaccine, just because of that one study suggesting a dramatically increased, roughly 13-fold increased risk in the 3 months after vaccination. I don't know why it's seen in that study but not seen in the other study I showed you, so it's not so clear. Luckily, not everyone needs the yellow fever vaccine. It's probably practical to avoid it if you have MS, if you're not traveling to an area that's actually endemic with yellow fever. So if you're going to an area that just doesn't have the disease, maybe you should just not get the vaccine just in case. Of course, as I mentioned, in modern times, a lot of people with MS are immunosuppressed, and it's not recommended to get any vaccine with living virus, which includes, unfortunately, the yellow fever vaccine. I'd be interested to know if you have MS. Have you had these vaccines? Were you diagnosed with MS shortly after a vaccination? Or have you had an MS exacerbation shortly after any vaccination? And what was that vaccine? Or have you had MS and tolerated all vaccines with no problems? And have you experienced the pseudo-exacerbation phenomenon? And let me know if you have any questions or comments or suggestions for other videos in the notes below.